What ethical questions arise from preconception genetic screening? Imagine having a tool that can tell you if you or your partner carry genes for certain health conditions before you even try to have a baby. It sounds helpful, right? But it also raises some important questions. When we look at preconception carrier screening, or PCs, we see it's all about testing people before pregnancy to find out if they carry genes for inherited conditions. This helps couples make informed choices about their future family. But with this knowledge come tricky ethical issues. One big question is about reproductive autonomy. Should people have the right to decide whether to get tested? And if they do they fully understand what the results mean? Genetic information can be complicated, and sometimes results are uncertain or unclear. Ensuring that everyone gives informed consent is essential, but it can be hard to make sure they truly understand all the details. Another concern is the emotional impact. Learning you might carry a gene for a serious condition can cause stress or anxiety. It could also pressure couples into making decisions they are not ready for or do not want to make. This medicalization of reproduction might make people feel like they are managing problems rather than experiencing natural life choices. There is also worry about discrimination. Could people be judged or treated unfairly based on their genetic makeup? For example, if someone is found to carry a gene for a condition, might they face stigma or bias? This is especially sensitive when it involves traits linked to disabilities. A bigger ethical debate surrounds the idea of eugenics. If PCs is used to prevent the birth of babies with certain traits, it can resemble old practices that aim to improve society by controlling who is born. This raises questions about respecting diversity and the value of all lives, regardless of genetic differences. Access to testing is another issue. Not everyone can afford or reach these services, especially in rural or underserved areas. This creates inequality, where some families benefit from genetic information while others do not. It can widen health disparities and limit fairness. Sometimes, PCs uncovers unexpected genetic information unrelated to the initial test. Deciding whether to share these incidental findings is tricky. It involves balancing the right to know with the possibility of causing unnecessary worry or harm. Genetic information can also affect family members. If one person learns they carry a gene, it might reveal risks for relatives. Ethical questions come up about whether to keep this information private or share it with family members who might want to know. Lastly, some argue that PCs could shift focus from individual choice to societal goals. Should screening be used to prevent certain conditions at a population level? If so, it might pressure people into making reproductive decisions they are uncomfortable with, which could threaten personal freedom. In the end, preconception genetic screening offers many benefits but also raises important ethical questions. It's about finding the right balance, giving families information to make choices while respecting their dignity, diversity, and right to privacy. Healthcare providers and policymakers need to carefully consider these issues to ensure PCs is used ethically and fairly.